All right, at this time, I would like to turn it over to fabulous Dr. Underwood, who is our other guest speaker today, and she is the dean of over the School of Health and Natural Sciences. A lot on her plate for sure, and she's also our COVID-19 university liaison, and I believe that entailed getting extra training with John Hopkins and everything. So this is your area of expertise. Thank you so very much for agreeing to speak to us this morning. We feel blessed, and the floor is all yours. Do whatever you need to do.
Well, good morning, everyone. Thank you for that introduction, Terry. The Terry's request was very timely. I just want to thank you all for listening in this morning. I actually, I'm going to share a presentation with you all that's similar to what I presented about a week ago for the American Association of State Colleges and Universities. I was actually asked by a president's wife, not Dr. Blake's wife, but another president within our 26 institutions' wife asked me to present for the National Association specifically about COVID-19 and how to manage the stresses. And so the presentation was already made. I have modified it slightly because there's been some updates to vaccine, and part of the presentation will talk about the vaccine and prevention measures. And so I appreciate the opportunity. Just a little bit about myself. My background is, as Dr. Blake mentioned, is actually in public health. Back in the early 90s, I worked at the Centers for Disease Control and Prevention. I worked for the National Center for Environmental Health in the Air Pollution Branch, but I also interned there at the National Center for Chronic Disease Prevention. And so, and teaching epidemiology is my first love. Epidemiology, I know you've heard that term in the news a lot. Epidemiology is actually the science of the study of disease transmission among human populations. And that's exactly what we're dealing with right now. And so a lot of public health professionals like myself are very busy trying to decrease the spread of this disease globally. And so that's why it's termed a pandemic. So at this time, I'm going to share my slides with you all. Bear with me just a minute. There it is. All right, great. And so the title of this particular presentation is Managing the Stresses of COVID-19, How to Survive and Thrive During the Worldwide Pandemic. In this presentation, I'm going to share some personal experiences and what I have done personally to survive and thrive. And as you all know, because some of you I've contacted because of either your exposure or you actually dealing with COVID-19, I personally have had very close family members that are currently dealing with it or have dealt with it over the last 2 weeks. So I am specifically not only just doing this for the university, but I'm living through it myself. And so the objectives for this presentation are identifying the potential signs of depression and other changes in behavior, which is very important right now. I think you've heard at the beginning of this last year, not only family members and a lot of us, but also the healthcare workers were very, because they were working long hours, they were seeing a lot of death in the hospital, they were depressed. And I'm just concerned about the mental awareness. And our USG system is also very acutely aware of the needs of employees that need to have other resources so that they can deal with their own mental health and awareness. A second objective is understanding the impact and purpose of a positive perspective for the future. Sometimes we tend to only live in the moment, and some of us, I have learned through conversations with employees or students, or even I've spoken with family members of students, they tend to have an attitude or a perspective of hopelessness, and that concerns me. And then lastly, the objective is preventive efforts necessary to decrease the spread of the virus in our world. Right now, if some of you are not familiar with Maslow's hierarchy of needs, the pyramid here, and it's normally something you hear when you're taking a psychology course, we are, as human beings in the world today, our need for physiological needs, safety needs, and belongingness has been touched by this pandemic. As you can see in the pyramid, our basic needs, and some people due to unemployment or less employment, safety and security, and then belongingness. You know, a lot of times right now, we're not able to hug each other. And because we're wearing masks, we're not even able to see each other smile anymore, not as much as we used to, unless we're in the a virtual meeting. And so with all that being said, I mean, we can't even shake hands right now. And I'm a touchy-feely type person, but I can't do that other than for those living in my household. I haven't even seen my adult sons for close to a year now. And so, you know, these are the things that are being touched from a human perspective, and we have to figure out a way to work around that in this temporary situation, because it is temporary and COVID-19 does have an expiration date. We all just have to believe that. So these are some of the signs of depression. They include a change in your dietary behavior. Some of us had weight loss. Some of us, like myself, had weight gain. Not that I was depressed, even though I did have my days. And I gained what I call COVID poundage, which I did not like when we all were shut down. Change in sleep patterns. Some people have a change in sleep patterns. And again, I'm speaking specifically about signs of depression. Perhaps we also had a change in our conversation. As I mentioned before, if you notice a family member or a friend having a conversation that involves an air of hopelessness or just not wanting to see tomorrow, or, you know, just kind of a downer type conversation, that's an area of concern. Spending habits may also change. I know some of us as women, we like to have retail therapy, and unfortunately during last year when everything was shut down, we couldn't spend, or perhaps we spent on Amazon or some of the other, mainly Amazon, some of the other places where we normally would be more aware of our budget. Our spending habits may have changed. Irritability is also a sign of depression, along with sadness and crying. And so again, my purpose today is to make you aware of the signs of depression that may be going on within your family or within your friends. And then I'm going to share ideas on what you can do about it. And so, as I mentioned earlier, social interactions are not as available as they used to be. And right now, my role as the COVID-19 liaison for the university is to make sure that our employees and our students are aware that social interactions should be minimized. One thing I have done is put Google Duo on my son's little tablet device. And that way, because he cannot see his grandfather who lives in Idaho, he's able to at least read to him every night. I started all over again. I have a midlife surprise at 7 years old. But my older sons are all adults and living on their own. But my son is able to just read a book to his grandfather who lives in another state right now, because, you know, we cannot visit. And that way they can see, it's something like FaceTime where they can see each other and he reads a book. Something else that me and my friends have done, who I actually were friends with about 30 years ago when we were in college, is we had a Google Doc that we created. And in that Google Doc, we shared each other's birthday, our favorite color, our favorite items, favorite holidays, and our favorite nonprofit organization. And so we have dedicated time at least once a month where we will get together and just talk about what's going on in our lives. We also have decided that we are going to donate to each other's nonprofit organization, whether it's, I have a friend in Los Angeles that's a part of the group, and she has a nonprofit. And so we give to her group, and that may be time, it may be money or resources or whatever we can provide. It also can contribute to scholarships. What we did during Christmas is, because we had this shared document, we were able to bless each other with our favorite things like fuzzy socks, something not too expensive. We put a price limit on it. Or a favorite holiday. For example, my friend in California loves yellow, so I got her a yellow blanket and a yellow cup. My friend here in Atlanta, she got something in blue, a couple of things in blue, and so on and so forth. And so maximizing social interactions using the virtual meetings is very important. And again, it's a way where you can gather with family members in a safe way. My husband also uses Zoom with his siblings. He has 3 other siblings, and every Saturday they meet virtually where they see each other and they talk about what's going on in the family. They talk about their goals. I have a sister-in-law that's trying to lose weight, and she's using, I can't remember the name of the program. I'm going to share some examples here, but they all talk about where they are in their lives, what they're doing, and just kind of keep each other updated every Saturday. They joke with each other, and it's kind of like they're in a virtual living room with each other. My brother-in-law lives in Pittsburgh. We're here in South Atlanta, Middle Georgia. And then we have my other sister-in-law is on the coast of Georgia near Savannah. So we're kind of spread out, but that's a way to stay connected. Other meetings, other than Microsoft Teams, I'm participating in Zoom meetings because I also serve on boards throughout the state as well. But again, the overall goal is to remain socially connected so that you are not feeling isolated and away from others and kind of just to yourself. As human beings, we're not created to live on an island or to be isolated. And you've got to put forth the effort to stay connected to your friends and family in some type of way. Now, this is another way to stay connected. I have one of my best friends lives in Sydney, Australia. And then I have another good friend that lives in Germany. And so one way to stay connected with them, other than, the Facebook, is international friends. There's Google Voice. I don't know if you've heard of it, and if you're interested, I can email directions on how to set it up. But when we were all shut down in March, I created a Google Voice number, and so did all of my advisors and my admin. And that was a way to create a local phone number. I was able to choose a 478 area code, and you can choose the numbers that are available. And that is a way to stay connected to your international friends as well. And so, again, these are other examples. Now, what my friends and I did when we met virtually last time, I believe we met last month, is we created a digital vision board. I'm not going to share mine with you, but this is something you can do. There's a lot of neat apps out there. I have a friend that is a Google expert and certified. She works for the Atlanta Public School System, and she showed us how to create a digital vision board. If you're not technologically savvy, you can do this with just a plain poster board. And I've done that as well, where you put a section on the board about your educational goals, your business or entrepreneurial goals, your travel goals. Put a cruise liner up there. If you used to love going on cruises on Carnival or Royal Caribbean or whatever, go ahead and create on that vision board a picture of a huge ship and imagine yourself on that ship one day, because you've got to believe in your perspective that things will get better and you will be able to book that cruise for a real vacation one day instead of a staycation. You can also add relationship goals or financial goals. Let's say you have a goal to get rid of a credit card bill or be debt free. These are all things that you can add on your vision boards. And there's something special about putting it in writing. And when you can look at it at home on your refrigerator or your wall or wherever you want to post it, you're more likely to stay dedicated to that particular vision that you've established for the year. So I mentioned the importance of perspective earlier. Perspective is your internal reality. And one thing I've learned as a human being is a lot of times, even when dealing with students, their perspective tends to be their internal reality, but it may not be the true reality of what's going on. And so your perspective is formed by a lot of different things. I've been in higher education for close to 20 years now. Before that, I worked in the international business world in Japan. But I have learned just through listening actively and having conversations with people that what they spend their time on and their past experiences tend to form their perspective. Whether it's true or the reality or not, that's what they tend to create in their minds in terms of a given situation. And so when I ask you, what are you spending your time on? With the news right now, make sure that you keep a balanced perspective of what's being reported. There were times in the news last summer where the news started to depress me because between COVID-19, the deaths, and what was going on with the social injustice, it was just a bit much. And it became a really a dark time, and I had to pull away from the news for a little while. And then I chose to just read books, watch movies. I love movies that kind of take me outside of my own reality, like Under the Tuscan Sun, which was filmed in Italy, one of my favorite movies. Julia Roberts is a phenomenal actor. I love just watching her movies, you know, things that kind of make me laugh and things that take me out of the times we were dealing with last summer. I also love reading books that, again, take you out of what's currently going on so that you can have a balanced perspective and you're not just dealing with doom and gloom messages coming out of the news media. Comedy, I love watching comedy. Again, laughter, they say, is like a medicine. And there have actually been studies about cancer patients that have watched comedies, and that kind of helped them heal over a significant amount of time. If they're constantly around someone that makes them laugh, or they're watching comedies, or just things that kind of, again, take them or shift their perspective, is very, very important. I mentioned philanthropy before, and that's something my friends and I are dedicated in doing. And I have noticed in my life, and in others' lives, just based on their stories and what they've told me, when you take the focus off of your own internal situation and put it on something you can do for your local community, or even the global community, that tends to help you with your mental health. And these are just examples of philanthropy that are being done right now, specifically dealing with COVID-19. We have Friends for Frontlines, the World Central Kitchen, National Alliance to End Homelessness, and Wounded Warriors. I am the wife of an Army veteran. I'm also the daughter of an Army veteran, and I have a brother that's currently serving in the Army. He's a colonel. And so I'm very closely connected to the military lifestyle and what that brings. I grew up in Germany, 9 years of my childhood, and spent time in Japan as well. And so because of that, I'm acutely aware of the needs of our military family members and the active duty and retired service members. Friends for Frontlines is an organization you can give to. And I don't know, you've heard on the news where there's a lot of philanthropy going on just to help our healthcare workers get through these unprecedented times where they're working long hours. Some of them mentioned that they're hungry or they work the night shift and the food wasn't always readily available. And so a lot of organizations made sure that they had warm, healthy food available to them during these long shifts they were working. And as the Dean of the School of Health and Natural Sciences, you can understand my heart's desire to serve our respiratory therapists and our nurses during this time. Homelessness is another near and dear alliance that I'm concerned about. If you've ever walked around downtown Atlanta during better times, they were not necessarily better for everyone. And so ending homelessness or trying to figure out what you can do to contribute to the problem is very important. And again, the goal here is just to take your focus off of your own situation and figuring out how you can give to better someone else's life. And the World Central Kitchen is another one. And so these are all examples of opportunities for kindness, but even in my own internal circle with my own family members and friends, being a blessing to them and sending them kind messages or text messages or just checking on them, sending virtual hugs is really, really important right now. And it cannot be, we can't take for granted how important it is just to connect with people you haven't heard from in a while. I have friends that I just say a good morning to, just to let them know they're being thought about, because a lot of times, again, especially during this time, you can't see their smile, you can't hug them, you can't do what you would normally do, meet them for lunch or things like that. And so these examples I'm going to share in the next slide are examples of where you can put together what I call care packages or care actions. They include, and I just did this, I have a delivery that should arrive today to some family members, where it includes tissue, some ramen noodles, because I know they love that, and just some other items just to make them comfortable during their quarantine. Instacart is another thing where you can just bless someone with some groceries because they're quarantined right now, and you can send them things that they may need, or that, you know, again, just that kind touch or that kind expression of, hey, I see you and I care about you is really, really important right now. I mentioned text messages before, movie recommendations during the holidays. Me and one of my best friends that I've known since 15, we would send each other movie recommendations that where we would encourage each other to watch them, whether they were comedies or what have you, holiday movies, something just to take us out of the doom and gloom messages we kept hearing on the news. The next thing I'm going to talk about is self-care. So I've talked about signs of depression. I've given you examples of how to take yourself out of depression by focusing on others. Now let's talk about yourself and what you can do to take care of yourself. As mothers, we tend to be there for our husbands and our children and our friends, but we've also got to focus on ourselves. And so in order to do that, the 4 areas I want you to think about right now, and these are things that I've talked about to family members and friends as well, is the importance of exercise. If you're in a neighborhood where you can just take a walk, I notice this campus is beautiful and we have people walking our campus every morning. I think I've seen some coworkers also walking the campus. If you can just take a 30-minute walk, the ultimate goal is to do at least 10,000 steps a day. And because we're not going to meetings physically right now, and a lot of our meetings are on FaceTime or on Microsoft Teams, we're not walking from one building to another. And so we're not getting the exercise and the steps in that we normally would. So if you can get a treadmill or walk around your neighborhood or walk around campus, if the weather is nice, that really will help you mentally as well as physically. Also meditating. Meditation can be done in a variety of ways, which include meditating on positive messages. I like when on my drive-in listening to positive, encouraging messages from Joel Osteen or Joyce Meyer. These are just my personal examples, or just music that has a positive vibe to it, and not a negative vibe to it. And again, just keeping your perspectives positive. Also, drinking water is very important. One thing with COVID-19, if you have already experienced it for yourself, is that it tends to dehydrate you. So it's very important that you drink water. Drink water. There's another, you can drink the sports drinks to keep your electrolytes up, but drinking water is very, very important, and it tends to help you with the healing process. This is a slide I found because everyone is at various stages in their life, but notice here for those 18 to 64, at least 150 minutes a week of moderate intensity activity, which includes the walking that I mentioned earlier, for at least 2 times a week. And then you can build on that. For women, we also have to do strength training for resistance purposes, to keep our bones strong and muscles strong, especially as we get older, to avoid injury later on. For 65 and older, again, improving balance is very important, and all of that comes with exercise. And I'm going to address another reason for exercise here shortly. One thing we were done that happened to us back in March last year is we were knocked off of our regular routine. And so even in the midst of this pandemic, it's very important to establish a new routine. That new routine may include prayer in the morning, inspirational messages, maybe even creating a gratefulness journal. Being grateful just for hot water, hot, healthy water is very important. There are places, if you've ever taken a cold shower or you've been places overseas, if you do any type of missions ministry, there are people living in the world today that do not have warm, clean running water. Their water is filled with parasites and other bacteria and things that we take for granted. So just being grateful for clean running water is something that I'm always mindful of. Being grateful that we do have resources available to us. I'm even grateful that we have internet connectivity right now, because if we didn't during this pandemic, we would definitely be in a world of trouble. Routine can also include the walking that I mentioned earlier, as well as exercise, going outside, getting vitamin D from the sun. It tends to change your perspective. And then creating healthy food preparation and meals. One thing I've started doing is juicing in the morning. I didn't do it this morning, but I normally juice kale, maybe carrots, pineapple. I may put kiwi in there. And if I can juice it and I put it in one of those mugs where It stays kind of cool all the rest of the day if I add ice to it. That's a healthy way to maintain the vitamins and the minerals that I need for my diet. I also share recipes with people as well. And so these are things that are important. And I mentioned again, the importance of just watching and listening to the healthy things. Those things that go into your ears and your eye gates are very important, and you want to keep them positive, especially right now. The benefits of exercise include reducing your risk of heart attack. February is actually Heart Health Month, and I'm actually wearing my pin here from the American Heart Association. Exercise helps you manage your weight better. It helps lower your blood cholesterol. It lowers your risk for type 2 diabetes and some cancers. And I mentioned the other things before, like improving your balance and lowering your risk of falls. So these are all very important. Now let's talk about COVID-19 and where we are in the state of Georgia. This comes from yesterday in the state of Georgia. And as you can see, I don't know if you can see my mouse moving, but the higher rates of COVID-19 are still kind of housed here in North Georgia. This is kind of Fulton County, Gwinnett County, Hall County. Those are the 5 counties with the highest rates of COVID-19. Right here, right below is Chattahoochee County. That's where Fort Benning is, and I'm not sure what's going on. The darker areas of the state are where the COVID-19 cases are the highest. Bibb County is right here, central Georgia, and we're actually doing better than we were. Back in January, the entire state was kind of dark, and that's not good. I see a county here that's white. I'm interested in wondering why that county has very low amount of cases reported. You can also see here in terms of the trend, as I mentioned before, right when we got started back in 2021 in January, I, along with my 2 task force members, Christina Meyer and Brittany Taylor, we were very busy at the beginning of the month. Things have started trending down for February, which is good. They're not having as many cases of COVID-19 reported as they used to, but we still need to get to a point where it's back down to where it was before the pandemic. That's the goal. The positivity rate as of yesterday was 11%. And what that means is for every 100 people that are tested for COVID-19, 11 of them test positive. So some of you may have questions about the vaccine. And as you know, right now we have the Pfizer vaccine that's out and the Moderna vaccine. Right now, Bibb County Health Department is giving out the Moderna vaccine. Both vaccines have the messenger RNA, and the vaccine, I know there's been a lot of myths out there, and I'm going to just clear that up for you. The vaccine does not give you COVID-19. It does not use live virus that causes COVID-19, and it does not affect or interact with your DNA in any way. What the vaccine does is it teaches our body how to protect against future infection. And it also protects us against serious consequences for getting sick with the virus. I was actually able to get my first dose of Moderna because I am the caretaker of 2 elderly parents. And someone just happened to counsel, and I just happened to be there at the right time. And I'm fine. I just have soreness in my arm right now, but I am doing fine. These are just comparisons in terms of side effects. In rare cases, there may be a reaction to it, but whenever you do get the vaccine, you have to stay, whether it's in the parking lot or depending on where you go, you have to sit there for about 15 minutes to make sure you don't have side effects. And the only one I've had is kind of pain in my arm where the injection site was, but again, I'm doing fine. In terms of the comparison for the 2, both of them are about 94, 95% effective at preventing COVID-19, especially preventing the serious cases of COVID-19 after receiving 2 doses, which is good news. I'm sure you've heard in the news about the Johnson & Johnson vaccine. So far, they have learned through research that it's 66% effective overall. It's 85% effective against severe disease. And again, that should be your main concern, avoiding getting severely sick where you're in the ICU at the hospital. And it's 100% effective against the hospitalization or death. The other vaccines that are in phase 3 clinical trials include the AstraZeneca vaccine, Janssen's, and Novavax. I believe Novavax, they're in a clinical trial at Morehouse School of Medicine in Atlanta right now, and they're using that particular one. AstraZeneca, I believe, is the one that is over in England at the UK. In terms of how to prevent the spread of COVID-19, I'm sure you've heard our messages over and over again. You're probably tired of hearing about it, but just wear a mask and make sure your mask covers your nose and your mouth. I've seen some people that double mask, which is fine as long as you can breathe through both layers of the mask. Wash your hands often. When you get gas, make sure you have a Clorox wipe and you have hand sanitizer. And when you get home, wash your hands thoroughly for at least 20 seconds before you start touching refrigerator doors or other things. Try to avoid crowds as much as possible. Avoid weddings. Most funerals right now are done at the graveside. They're not holding them in churches. I actually, unfortunately, had to attend a funeral last year around June, the beginning of June. And continue to social distance. Avoid those crowds and social distance as much as possible. And make sure that your mask, again, fits snugly on the sides of your face and under your chin. So this is a summary. Look for signs to counteract depression. Make sure you're watching your relatives and family and friends as well. Change your perspective if it's negative. I'm normally the person that is the glass half full type person. My attitude has always been optimistic, and I always try to look at the good of things, even when they don't go my way. I always look at, well, at least this didn't happen, or at least this didn't happen. That tends to be helpful for me as a person. And adopt preventive ways to stop the spread of 19 in terms of the vaccine, and doing what I mentioned earlier, wearing your mask in public places and so on and so forth.
Thank you so much, Dr. Underwood. I really enjoyed your PowerPoint and agree with so much of what you said. And I'm glad you explained the difference between the vaccines. I didn't really understand it, or the effectiveness or assumed effectiveness of it. Does anybody have any feedback or questions? Last chance. I have an expert.
This is Marie. I do have a question. I had a student with me. I'm sorry. I had to take a break there for a second. The part about the vaccine not having any live virus in it, can you explain how the vaccine works if there's nothing live in it for your body to learn to fight against?
So the vaccine provides a weakened strain of it, and the messenger RNA actually is it's a very deep biological type of thing that happens. It kind of teaches your body how to fight against COVID-19, the virus. So it again, there's a very deep biological aspect of it, but it's not like the flu vaccine, which is a weakened strain from what I understand. The mRNA, which is what you've been hearing in the news a lot, it kind of sends a message to our body so that our body is better prepared to fight against it if we're exposed to the virus. And so our bodies are very complicated and intricate in their makeup, and it's amazing what they can do. The antibodies, for example, I had a close relative get the antibody infusion the other day. And what the antibodies do is they fight against foreign substances like the virus. And the antigens are the foreign virus that can enter our body like a cold. And that's what COVID-19 is. It's a bad coronavirus. It's a really bad, kind of like a cold. A cold is also in the category of a coronavirus. And so is the flu. They're all categories of coronaviruses. But this particular vaccine helps send a message to our body to fight against it if we're exposed to it. And that's really what's been helped. I was hesitant to get it at first, but because I've had some very close family members to get it, I went ahead. I'd rather have some type of protection than none at all at this time. Does that help?
It does. And one more question. Have you heard anything about if you have had COVID and you had a bad case of COVID, has there been any research or studies or anything come up about whether that should determine whether or not you take the vaccine and when?
So excellent question. For my family member that just got the antibody infusion on Tuesday, she cannot get the vaccine until 90 days now. She has to wait but I have seen some research that says if you test positive for COVID and you just kind of get through it with the basic meds and what doctors prescribe is a Z-Pack, and depending on, everyone is different. I've had conversations with close to, it seems like 1,000 people now, unfortunately, in my database between students and employees since last year. And everyone's experience is different. Some people have vomiting and diarrhea and they have trouble breathing. We've had, unfortunately, to call the ambulance for some students in the residence halls. But some students and some employees only have a runny nose, or they only have a headache for a couple of days. But for those of you that just kind of get through it, I heard the other day that your antibodies that currently exist in your body are like a booster. So when you do get the vaccine, it makes the vaccine even more effective. So keep that in mind.
So what about those that had bad cases? I don't mind people knowing that I had this back in October, and it was horrible. I had a very bad case of it. I couldn't breathe. I had just about every symptom that you could think of to have. So for somebody like me, I'm well past the 90 days now, but is it recommended that we still get the vaccine as well, or is that something that we should wait on?
You should get the vaccine since you're past your 90 days. The virus can actually stay in your body for up to 12 weeks. And so that's one of the reasons why we do not require employees or students to provide a negative test before returning to campus or to work, because you can test positive for up to 12 weeks. But now that you've gotten through it, did you get the antibody infusion treatment?
I did not.
Okay. Yes.
It wasn't even offered. I really honestly didn't know it was a thing. I went to the hospital twice, and the only thing that got me through was my doctor actually told me not to lay in the bed, to get up and move around, to keep my body moving, and to drink juices, and to start taking the vitamins that fight against it, which was the D, the E, the C, and the zinc.
Yeah. Right. Yeah. And a lot of those vitamins are in elderberry, which is what I've been telling people to do since last year. I am a huge elderberry fan because it contains the zinc and the vitamin C that you need. I can't remember if it has vitamin D, but I keep it in stock. I ordered it from Amazon, elderberry. And I'm not sure if the antibody treatment was available back in October.
I don't think that it was. I think it was testing it.
Right. So it was not available. You probably would have been prescribed to get it, or there would have been an order for you back in October if they had it available at the time. Like I said, with my family member, she just got it Tuesday, this past Tuesday. So.
Thank you.
Yes.
We do have a question. Will there be vaccines available through MGA?
So good question. And yes, there will. That's been another Herculean task that I've been involved in. We actually were approved to provide the vaccine on the Macon campus, and the order has been placed, but I'm sure you've heard in the news there, I don't know how many we ordered. I can't remember the number, but we have been approved as a vaccination site, and we're going to be a closed pod. We have been approved to do it on Macon campus right now, and we have also submitted application. We did it back in December, and we've submitted an application to offer it on the Cochran campus too. We're just waiting for that approval as well. And so, yes, we will be a closed pod. We will offer it to eligible employees and students whenever the governor decides we're ready to move to the next tier. I see another question. Will coaches be the first in line? I'm not sure. It may depend on the coach's age. But what can happen when the governor moves it down to the next tier, which I believe is 1B for educators? That applies to everyone, every employee at Middle Georgia State University. All you have to do is show your employee ID, and you're considered an educator because you're, with our university. And so coaches will be included in that number. Now, if coaches, I see the question, if they're 65 and older, they can get it now. And so, yes. Any other questions?
Yes, now, Dr. Underwood, I have one question. I might have missed this because I had to step away for a second. It's my understanding that there's a second part to the vaccine. Can you kind of explain how far apart you get them and what the purpose is of having to do 2 separate dosages?
Good question. So for the Pfizer vaccine, it's a 2-dose vaccine, and you get the first dose on one day, and then you come back 21 days later to get the second dose. That's the best case scenario, but as you know, right now they're having challenges with keeping the inventory, and those that are offering it, like the health department and certain pharmacies, they're trying to make sure that when they place the order, they keep that in mind so that people can come back and get their second dose. With the Moderna, you have to get the second dose 28 days after the first dose. And the purpose of that is just to boost your immune system. And again, to make sure that you have enough in your system to fight off the infection. It actually increases your fight, if you will, against the getting COVID-19 when you get that second dose. With Johnson & Johnson, it's only a 1-dose vaccine, and the research is still out there. They said in the news this morning that they hope to have it approved, I believe, by March, with dissemination by distribution in our country by June, I believe. Of course, all that can change, but that's a 1-dose. And so we'll see what happens, but that's the purpose of the booster shot. It's similar to the HPV vaccine, where I believe that's a 3-dose vaccine, and each time you get the booster shot, it just increases your body's ability to fight against it.
Thank you so much. And I have one last quick question. I have heard a lot of conflicting views about the rapid COVID test not being accurate and giving a lot of false positives or vice versa. Can you share your professional opinion on that? Because I personally only get the nose swab because I just don't trust it.
Right. Excellent question. So due to my recent exposure with a coworker, I went and got tested at the health department. I got the PCR test, and that's where they go a little deeper in your nasal cavity. It's not that bad, Terry, but I wanted to make sure, because I did not have any symptoms. I wanted to make sure I was definitely negative before I came to work. And so I came out negative, thank goodness. And that's the PCR test, and that stands for polymerase chain reaction. The Binex Now tests are the ones we currently have on the Macon and the Cochrane campus. They're a rapid test by Abbott Laboratories, and you will know your results within 15 minutes. Now, with that particular rapid test, however, you have to be symptomatic for it to work accurately. And so the likelihood we will be able to get a true and accurate test depends upon the patient's symptoms at the time. I have been told, and research has shown, that rapid test, the one where you'll know your results within 15 minutes, that it's only 70% accurate if you have symptoms. And as you know, a lot of people are walking around positive with absolutely no symptoms. And in my interviews with a lot of folks that I've talked to, affiliated with our university, they don't have any symptoms, but I have to keep them in isolation or quarantine because they are actually positive. But the best way to measure that, we also on our campuses, on both campuses, we have another form of the PCR test, which is a saliva test. And all of the coaches and the athletic trainers and of course the nurses are trained to do the saliva test. The saliva test is another PCR test that accurately identifies those who actually have the COVID-19 virus, whether they are showing symptoms or not. And so we have both tests on both campuses right now.
Thank you so much. This is extremely helpful.
You're welcome. You're welcome. Well, I want to thank you all for your time this morning. My address is tara.underwood@mga.edu. If you have any other questions, I have been here for everyone, and I try to respond to emails and inquiries and phone calls as soon as I can. So I'm here for you. Public health is my passion, and I really have, unfortunately, I wanted to step up and help the university as best I could. And hopefully we're doing a good job in keeping you informed. And I wish you all the best of health and wellness as we get through this pandemic together. Thank you for your time.